Take 200. Hi there. I'm going to be showing how to do a simple sterile dressing change using the no-touch method. I've already gotten consent from my patient Samuel to film this video, and I've already checked his name as well as his date of birth against his wristband, as well as made sure that he has no allergies whatsoever, and informed him on what we're going to be doing today, which is a dressing change and taking a look at his wound to make sure that there's no infection going on and that it's healing okay. So how are you doing today, Samuel? Good. Before we get started, do you have any pain at all? No? Good. And how was your dressing change yesterday? How did that go? Good. No pain from that? Good. Do you have to use the washroom or anything before we get started? No? And do you have any questions for me? Okay, and you're comfortable? Perfect. Okay, so we are going to start by taking off his old dressing. I'm just going to sanitize my hands and put on a pair of gloves. There we go. And I am going to be pulling the dressing away from myself so that I can see the wound and what is on the dressing, but the patient cannot. Perfect. So we're just going to hold this down and pull away, nice and gentle. And I'm also checking on Samuel to make sure that he's doing okay during the process as well. There we go. The dressing to see if there's any exudate or any drainage on there, and also checking to see how the wound is, if it's moist, if it's dry, how it's healing. Just going to throw this out. I also have a garbage can down here as well. Perfect. And we can remove these gloves. Check on Samuel. He's still doing okay. Perfect. I'm just going to re-sanitize my hands. And then we are going to open our sterile field. And when opening our sterile field, we want to make sure of a few things: that we are not turning our back to our sterile field, that we are aware of the 2-inch border that is contaminated, which is a great place to lay our forceps down. We also want to make sure that we're not bringing anything over our sterile field, and yeah, we'll talk about it as we go. So, in my sterile field here, we're going to start with opening it away from ourselves, I should say. So that's the first corner there, and we're going to try and touch only, well, as much as we can, the back side as well as that 2-inch border to not contaminate any of the sterile field itself. We can go from the side and the other side. And then when you pull the back part here, there's a pair of forceps sitting there, so I'm just going to pull those out and hold them as I continue to pull this out so that I have a good place to lay these down. Also so that they're in your view. So I'm just going to adjust my sterile field here, and I'm just going to lay these down because these are now contaminated and not sterile, with the handle in that 2-inch border there so that I can grab them. Okay, and also keeping in mind that this part here is, the part that is hanging over is also contaminated. Also, I am rudely facing my patient. He is aware that I'm filming this video and he has said that it's okay. Thank you, Samuel. So we have a garbage bag. I already have a garbage bag, so I don't need that. I'm just going to discard it. We also have this. Okay, and then we have 2 more pairs of forceps here, which we're going to do the exact same thing and lay the handle within that 2-inch border. And then I have my normal saline here, which I've checked the expiry on and made sure that it's 0.9%. In most cases, I would make sure that it is sealed as well, but in this case, I have practiced 100 times. So I'm just going to go ahead and pour it into one portion of my tray. Fill it right out. And again, making sure that I'm not hovering over the sterile field, that I'm staying back here and only going over when needing to, which is why I have everything to my side right here. Perfect. And then picking up the pair of forceps, we're going to start to clean the wound. So I'm going to take a piece of gauze here. Got another pair of forceps. And I'm going to dip this piece of gauze into the normal saline, and then use the other pair to help wring it out. There we go. Before you guys keep watching, I can feel you cringing already. I just want to acknowledge that the tips of my forceps should be down because if they are up, then the liquid can drip down and contaminate the rest of the forcep. I would have redone the video, but this was already my 200th time filming and the best view for you guys to watch, and of course the only video that I do not have my tips down. And then I can go ahead, place those back down within the 2-inch border. And I'm going to do my first swipe from top to bottom in the main part of the wound here. And I'm only going to hold this down because it won't stay up. So just top to bottom, right down the middle of the wound. And we can take this and throw it out. We also don't want to bring anything below the sterile field, below our waist, because once it is contaminated. So I can go ahead and grab my forceps again and do another dipping into the saline. Then we can take this and wring it out again. There we go. Come on. There we go. So put those back down, and then we are going to go on our farthest side and do top to bottom on the outside. Top to bottom. And we're going to throw that one out. Do the same process to do the next side. And again, just wringing that out. And I'm only going to do 3 swipes this time, down the middle and on each side. I am running out of gauze. And it's also not that large of a wound. If there had been some exudate on the outside surrounding skin, then I would have made sure to clean that area as well. But it has been pretty localized to the wound itself. So, and then I'm just going to go on the side closest to me from top to bottom. Perfect. So now all 3 sides have been swiped. Wonderful. So throwing that out again. And we're going to put this forceps on this side here. And I'm going to take a piece of dry gauze. And I don't have to wear gloves for this because nothing that I'm touching is actually touching the wound itself. Everything is being touched by sterile tweezers here. So to dry the wound, again, same place I started. So we're going to go top to bottom, right down the middle, and throw that one out. And then top to bottom on the far side to dry it. And again, this is sterile gauze. And then closest side to me, top to bottom. Perfect. So we can throw that one out. Place our forceps down. Wonderful. So now that that is dried and cleaned and Samuel's doing good, he's in no pain whatsoever, we're going to grab a piece of gauze using the forceps again. We're going to place this piece of gauze onto the wound. We need one. There we go. We'll place that one beside it. And then we will grab the Meator. And we will place it on the wound, and I'm flattening it out with my hand here. Perfect. And there we go. And that is how you do a sterile dressing change. To pack everything up, you can just put everything in the center of your sterile field and wrap it back up.